what is the difference between chemotherapy and targeted therapy? So this can be quite confusing because often chemotherapy and targeted therapy are just given as a drip. Also, particularly for late stage cancers, it's very common to use both together. Some targeted therapies work very well with chemotherapies, and some targeted therapies help chemotherapy work better. I try to use the term molecular targeted therapy instead of just targeted therapy because, yeah, some people call things targeted therapy when they're like not really, and it gets very confusing. So chemotherapy is a systemic treatment, so that goes in your whole body. Hopefully it kills some cancer. Unfortunately, it gets other bits of your body too, your skin, fingernails, lining of your stomach, lining of your intestines, that kind of thing. Any wounds that are healing. Yeah, so you could say chemotherapy is generally not targeted. Molecular targeted therapies, they target cancer cells because they find markers on the cancer cell. These could be because like certain types of cancer, the cells overexpress a certain protein. So with colon cancer, for some patients, the cancer cells overexpress epidermal growth factor receptor, which is a receptor on the surface of the cell that's associated with skin growth. And therefore, patients who are overexpressing that with the cancer cells may be good candidates for a targeted treatment that targets that. So the two well-known ones are Erbitux, also called cetuximab, and Vectibix, also called panitumumab. Unfortunately, your skin produces epidermal growth factor receptor as well. So those two targeted therapies are associated with very unpleasant skin problems. So yeah, the difference between chemotherapy and molecular targeted therapy is that targeted therapy hopefully is mainly getting the cancer cells. That doesn't mean it has no side effects because other cells may have those same targets on. And yes, some targeted therapies work very well with chemo. So in the case of cetuximab, it seems to work well with a slow infusion of 5-FU. Colon cancer patients will be very familiar with 46-hour slow infusion 5-FU. That seems to make cetuximab work well. And some targeted therapies help chemo. Classic example of that would be bevacizumab, also called Avastin, which seems to help basically all chemo work better. It is confusing because often, especially as late stage patients, you're always being given chemo and targeted therapies together. And as far as you're concerned as a patient, it's just a different drip. You're having a drip of something, and then chemo nurse will come over and say your drip's finished. Now we're giving you this other one. So you might have a series of many drips, spending a day in hospital. Not fun. So that's the difference between chemotherapy and targeted therapy, or particularly molecular targeted therapy.